Now we have a lot of nurses and doctors that's on the front lines, fighting the coronavirus. And you have a nurse that's from Nevada. Her name is Nicole Sirotek. Now she went to New York to assist, the nurses and doctors there with this pandemic. But there have been a lot of stories coming out of New York about medical negligence and mistreatment. And she noticed, Nurse Nicole noticed that she went to a hospital where they served a lot of, people who were non-white, so it could be black, Puerto Rican, etc., right, in New York. And she noticed how bad the people were being treated. She talked about how they're literally just killing people because of medical negligence. And I want to play a clip of this, what this nurse is saying, because this has been going on. Nobody's been paying attention to anything. Nobody cares. And this is why a lot of black people are always, very cautious when it comes to the medical industry. But let's go ahead and roll that short clip.
On. Oh, great goodness. It is 8:42 New York time. And I got to my regular unit and they took my patient away, my black guy. And now I'm getting switched units. This is exactly what happened before at the other hospital. As soon as I told somebody, like management, and tried to advocate for my patient, they take the patient away from me and then they move me. So I legitimately don't even know what to do anymore. Even the advocacy groups don't give a shit about these people. Literally, Black lives don't matter here. And I mean, that's pretty sad that somebody who is white and lives hundreds of miles away from the city gives more of a shit about these people than the actual people in this city. For real. I had a complete breakdown yesterday because, I missed an important email to do a revision on my proposal, so my proposal got canceled because I was trying to advocate for my patient and talk to management here and get the care that he needs because he's being medically mismanaged. And I just had a complete fucking breakdown because, my entire proposal got canceled because I, wasted my time advocating for a fucking patient who's just gonna die anyway. And sure enough, they take the patient away from me, and then almost 2 hours into the shift, they switch me units. This is exactly what happened at the other hospital when I was advocating for the little Hispanic lady. Guys, here's the thing. Let me try and put things into context for you, okay? I know not everybody's gonna live. I'm not that fucking green or ignorant or bright-eyed and bushy-tailed to think that, okay? I know we're gonna have a shit ton of people die. But these people aren't dying from COVID. Let me give you several examples here. An anesthesiologist intubated the patients, I think it was right, bronchi and of a patient, and they couldn't get the sats up, and for about 5 hours we were waiting on a chest x-ray to confirm that the placement was wrong. And in the meantime, while we're waiting for that, and we've told the anesthesiologist that it was placed wrong because literally only one side of his fucking chest is inflating, he dies. Okay. A patient had a heart rate of 40 and the resident started doing chest compressions on him, which is not what you do. You just externally pace them, or you give him some atropine. And then, I run in there to stop him from doing chest compressions on somebody with a fucking pulse. And then he decides to push epi. He throws some pads on him to defibrillate the guy in bradycardia. Okay, he has a heart rate of 40 and a stable, bradycardic rhythm. We just need to give him some atropine and pace him. He fucking defibrillates him and kills him. And I was literally ran out of the patient's room to get the director of nursing who was standing out there, and I'm like, can you stop him? He's going to kill that patient. He's going to kill that patient if he defibrillates him with bradycardia and a heart rate of 40. And the director of nursing just shook his head, and I turned around and he killed the dude. Okay? There was a nurse who placed an NG tube into some guy's lungs and filled his lungs with tube feeding. There was a nurse who confused a long-acting insulin with a short-acting insulin and gave 30 units of a fast-acting insulin and killed the guy. What else? Other stuff have I seen? Yeah. It's just here they're just gonna let them rot on the vent. They're medically mismanaging these patients. And like, I'm not a doctor, guys. I'm not professing to be a doctor by any means. But there's, like I said, basic standards of care that we have to do. Like, when somebody's low on blood, like literally on the brink of a critical low blood level, we should replace the blood. But I asked the residents and they're like, does he have internal bleeding? And I said, no. Then they're like, well, we're not replacing the blood. Well, here's the thing. In these COVID patients, they all eventually need a blood transfusion. Their blood, like, if you don't have enough blood to actually oxygenate your body, the vent settings don't fucking matter, okay? They don't matter because you have no oxygen carrying capacity of your blood, okay? I told you about the patient where like all that like purulent drainage just kept seeping into his lungs because the ET tube cuff was leaking and nobody has a fucking manometer here to check the pressures. And I finally figured that out. And I kept saying, hey, you know what? His white blood cell count is steadily like, you know, we're having a problem with it. Like, do you want to start some antibiotics? No. Well, does he have a fever? And I said, no, he doesn't have a fever. They didn't want to start antibiotics. Day shift nurse finally got a chest x-ray. He has full-blown pneumonia now. Like, I've been telling them this for a while, but because he didn't have a fever, they didn't want to give him antibiotics. We have a nurse who, like, fell asleep at the fucking nurse's station while we were all in rooms, and her norepinephrine ran out, and the guy had no fucking blood pressure and didn't perfuse his brain, and I'm pretty sure he's brain dead. That same nurse is now running a CRRT machine, a dialysis-like machine, that she has never done before. She said she'll figure it out, okay? I'm pretty fucking smart, and I figure a lot of shit out, but I would never attempt to try and figure out a CRRT machine on the fly. Like, we are adequately staffed. There's a shit ton of staff in there, like, and we have a nurse who does CRRT in there. She has a different patient load. We told them, like, hey, let's just swap these nurses so the one that knows how to work this machine can work this machine, but they didn't want to do that. So I'm pretty sure that patient will be dead here in a couple hours. And this is why I freaked the fuck out yesterday. Because nobody is listening.
So first of all, I want to tell the nurse thank you for, speaking up. Thank you very much for that. Thank you for what you're doing for the people. And we need more people like her to speak up. You know what I'm saying? Just look at people as human beings, not the freaking color. You know what I'm saying? Because that color situation is annoying. And I hate this country even started off that way and is maintained that way. But human beings are human beings. And that's what I always tell people. You have good people in every group and you got bad people as well. And this is, lady is one of the good ones that's speaking up, because she said that, listen, this is happening to black people. This is happening to, I assume, brown people as well, or, Asian people, whoever else has happened to. She's saying that just because we are in the hood, she said, doesn't mean these aren't people. Now, she says she grew up poor, so she knows how it feels not to have anything. And, a lot of times when people grow up poor, they work hard and make something of themselves so they don't make a life like that for their children. But this is what a lot of us have speculated was contributing to some of this. It's just no one cares about the health of black people. But shoot, black people can't even get tests. I keep reporting stories over and over and over on our African Diaspora News Insider channel. I reported 2 stories of one nurse that couldn't get a test that worked at a hospital, a teacher that died of the coronavirus, couldn't get tests until later on down the line. They would have caught it. It should have been okay. I mean, so we can't get tests, and then we do get in there, we're treated any kind of way. I mean, this is not safe at all for us as black folks. Then we don't have many black doctors out there. Not many in the United States. So it's just, Babylon is not a good place for us. I'm glad this woman spoke up. I'm glad this woman did the right thing, and may God bless her husband, and her children. I mean, like I've seen her husband and children for taking a stand, for doing a righteous thing. But this is why prevention, ladies and gentlemen, prevention has to be our focus from now on. We can't allow ourselves to go down with our health and put our lives in the hands of these people, because during the pandemic, they're not going to test you. They're not going to test me. They're going to test them. And that's the sad part. No one deserves to be treated differently when you come to the hospital, or no matter what your zip code is, or the color of your skin, or what money you have. That's just wrong. Human beings are human beings. And unfortunately, in this country, it's not about human beings. It's about what color you are, and also how much money you have as well. That's another thing, because I know I have people that watch my channel and they're white, and they say, hey, man, I ain't got money like that. I don't. I say, you may not have money. I know, definitely seen a lot of poor white people in my day. I have. But, white privilege is something you have regardless, whether you got money or not. And that's still in your favor, So my thing is this. Please, ladies and gentlemen, please, avoid these crowds. Even though these states are opening back up, look at the data. You can look in your state. I check every day the coronavirus numbers for the state of Texas. I check it to see if it's spiking up or spiking down. All you have to put is whatever state coronavirus numbers, and it pops right up on Google. Okay, check it. You see your numbers keep spiking up, then maybe you need to stay home a little bit longer. Okay, do that. We got to do that to protect ourselves. The governors are not going to protect you. They're not. The spoiled brats in out here, the COVIDiots out here, they don't care about spiking numbers or anything. So we got to care about ourselves. Okay, get your essentials, wear your mask when you go out. Definitely wash your hands. Practice social distancing. I know when you go out, you're gonna see Becky and Brad not wearing a mask. I know. Trust me, I seen it. I go to the store, they don't want to wear it. So forget that. They looking at you like, why you got on a mask? Like, F you, I'm wearing my mask, Becky and Brad. You can catch the coronavirus if you want. I'm wearing mine. And then places like Costco saying you got to wear a mask. And I've seen them say, well, if I got to wear a mask in Costco, then I'm not going to shop there. Good. Go. That means there'll be more items for me when I go shop. But I'm asking you, brothers and sisters, please take care of yourself out here, because this nurse is warning you, especially brothers and sisters in New York. This came out of New York, brothers and sisters. And she said in the video, don't go somewhere else. Don't go over there in their hospitals. This is a woman that's working in it. You understand? She's working in it. And she's just letting us know what's going on the front lines. But leave me a comment there if you know anything about the situation with this nurse, because this is just, this is horrible. I hate to even hear this lady, have this much to spare, but I'm glad she was brave enough to tell us the truth.